we're going to talk about a health condition that affects millions of people, but it's often misunderstood or honestly just missed completely. Today, we're diving into polycystic ovary syndrome, or PCOS for short. So let me ask you something right off the bat. What do you think is the common thread connecting something like infertility with a much higher risk for diabetes and even anxiety? I mean, on the surface, those things sound totally unrelated, don't they? A pretty strange mix. Well, for up to 1 in 5 women of reproductive age, the answer is polycystic ovary syndrome. Just let that sink in for a second. In any group of 5 women you know, there's a good chance one of them is dealing with this. That makes it one of the most common hormonal disorders out there, and yet so many of us have barely even heard of it. Okay, so what is PCOS really? At its heart, it's a super complex condition that's about way more than just the ovaries. Think of it as a blend of reproductive issues and metabolic issues. It's all driven by hormones being out of whack and this one really key thing called insulin resistance. All insulin resistance means is that your body cells kind of stop listening to insulin properly. This can mess with your blood sugar and set off a whole chain reaction of other problems. This idea is crucial, so keep it in mind. And that's actually a perfect way to think about it. The best analogy is that PCOS is like a two-sided coin. One side is all about reproductive health, and the other is about your metabolic health. And it hits both sides hard. So let's break down those two sides. On the reproductive side, you've got the things people most often connect with PCOS. In fact, it's the single biggest cause of infertility for women who aren't ovulating. But then you flip the coin, and you get the metabolic side. And honestly, this side is just as critical, because this is where some really serious long-term health risks start to pop up. And I want you to really get how strong that link to infertility is. Check out this number. A whopping 90 to 95%, 90 to 95 of women who go to a doctor for help because they aren't ovulating end up having PCOS. That statistic is it's staggering. It really shows you how central this condition is to the whole conversation. Now, over on that metabolic side, things get just as serious. And look, the point here isn't to scare anyone. It's just to be clear about the stakes. Women with PCOS have a 4 times greater risk of developing type 2 diabetes, and the risk of a heart attack can be up to 7 times higher. These are not small numbers, you know? It really drives home that managing PCOS isn't just about fertility. It's about your long-term, lifelong health. And the impact doesn't stop with the physical body. The toll of this condition goes so much deeper. All those hormonal shifts, the metabolic problems, sometimes combined with physical symptoms that people can see, it can all take a huge psychological toll. It's no surprise that we see higher rates of anxiety, mood disorders, and struggles with body image. It truly is a condition that affects the whole person, inside and out. Okay, so you might be thinking, if this is so common and can be so serious, it must be pretty easy to diagnose, right? Well, not exactly. And that leads us right into what I like to call the diagnosis puzzle. I mean, it's a totally fair question. With millions and millions of women affected by this, why is getting a diagnosis so hard? Why does it get missed so often? Okay, a huge piece of the puzzle is this. Now, don't worry about the fine print here. That's not the point. The main thing to see is that different medical organizations literally use different checklists to decide if someone has PCOS. So if the experts themselves can't even agree on one single set of rules, you can imagine how confusing that gets for doctors and especially for patients. So let's try to make that a little simpler. The most common system that's used is called the Rotterdam criteria, and it basically works on a 2 out of 3 rule. A doctor's looking for these 3 main features, and if a patient has at least 2 of them, a PCOS diagnosis can be made. It's kind of a way to cut through all that confusion we just talked about. All right, so once you finally get through that whole diagnosis puzzle, what happens next? Well, the good news is there is a really clear path forward for managing it. This is where things start to feel a lot less overwhelming and a lot more in your control. The way doctors approach treatment is kind of like building a house. You have to start with a strong foundation. And for PCOS, that foundation, the absolute first step is lifestyle. We're talking diet, exercise, daily habits. All of that comes before jumping to medication. Then, if that's not quite enough, step 2 is adding in medications. But it all starts with that lifestyle base. So why start there? Why is lifestyle so important? Because the results can be absolutely incredible. Get this, the research shows that losing just 5 to 10% of your body weight can have massive clinical benefits. We're talking improvements in everything, reproductive, metabolic,
and psychological health. That is a huge return on investment for what can be a pretty modest change.
But, lifestyle changes can sound kind of vague. What does that actually mean in real life? It's one thing to see the data, but a real story makes it all click. So I want to introduce you to Geeta, whose journey is highlighted in the source material. So Geeta's story starts in a place that probably sounds familiar to a lot of us. Her diet was heavy on carbs, and she wasn't very active. But the changes she made weren't anything crazy or extreme. It was all about finding balance. She started focusing on getting more protein in her meals, and she just started walking every day. See? These are the kind of practical, sustainable things that people can actually stick with. And the payoff for those simple changes? It was huge. After only 6 months, Geeta lost 12 pounds, which was about 8% of her body weight, and she successfully conceived. Her story is just the perfect real-world example of how powerful these targeted lifestyle adjustments can be. Okay, so let's take a step back and put all these pieces together. What's the bigger picture here? All right, let's boil this all down to the key takeaways. First, PCOS is super common and it's complicated, hitting both your reproductive and your metabolic health. Number 2, it's a huge cause of infertility and comes with some serious long-term risks like diabetes and heart disease. Third, getting a diagnosis can be tricky, but that 2 out of 3 rule is a really helpful guide. And maybe the most important takeaway of all, lifestyle change is your number 1 most powerful tool for managing this thing. At the end of the day, what we really need is just more awareness for patients and doctors so people can get diagnosed sooner and get the help they need. And that really leaves us with one big question, doesn't it? We know PCOS affects millions of women, but so many of them still struggle for years just to get a name for what they're going through. So I'll leave you with this. What do you think it's going to take to finally bring this hidden condition out of the shadows and into the light?